my husband and I had planned when he retired for us to take many little trips and see the things that we wanted to do. And I wasn't able to walk or to do any of the things to be his partner.
It's because it's so painful, you can't be active the way you want to be. It just is impossible. At least I reached the point where I had so much restriction that I couldn't get in and out of the car without almost having help. I couldn't move, I couldn't go upstairs. I got to the point where I was using canes, 2 canes, and that's pretty encumbersome.
I had this long dresser that was right beside my bed, and so I would hold the dresser to limber my arthritic knee up to get some movement into it and so the pain wouldn't be so bad. But that morning when I got up, I held to the dresser, and by the time I got to the end of the dresser, I just started crying, and I thought, I can't do this anymore. I've pushed my time as much as I can. I had to make the decision. There was no decision at that point for me. I knew the decision was made that I couldn't live like that.
Played tennis, and I went down to see the doctor to see if there was some medication he could give me to alleviate the pain. And he said, there's no pill, no injection I can give you. You need a new knee because you have no cartilage. And he showed me on the x-ray where the cartilage was missing, and it was bone rubbing against bone.
Do you ever experience pain while bearing weight on your hip or knee? Do you limp? Does your knee become swollen with fluid? Are you experiencing a decrease in your knees or hips' ability to move freely and flex, a term your doctor will call range of motion? If you answered yes to any of these questions, you may be suffering from arthritis, a degenerative joint disease. Musculoskeletal disorders are the most common causes of long-term pain and physical disability, affecting hundreds of millions of people worldwide. If you are considering knee replacement surgery, you're not alone. Over 250,000 Americans receive knee implants each year, and as the baby boomer population ages, this number is expected to increase significantly. Not all that long ago, in 1968, the first modern knee replacement surgery was performed. Like everything else you've seen and experienced in the world around you, the understanding and technology improving this now common surgical procedure is remarkable. Knee replacement surgery is regarded as one of the greatest advances in orthopedic surgery of the 20th century. This procedure is often recommended when knee pain becomes so severe that conservative treatments, such as medication or physical therapy, no longer help. Statistics have shown that knee replacement has proven successful in over 90% of patients, often helping them regain mobility and relief from debilitating pain. In short, improving their quality of life. To understand why you have knee pain, it helps to be familiar with the anatomy of the knee joint. Your knee is a hinge joint formed where the femur, your thigh bone, and the tibia or shin bone meet. When your knee is healthy, the joint moves freely and painlessly because of the cushioning and lubricating effect provided by cartilage. When a knee becomes damaged or worn, not unlike the tires on your car after many miles, the joint loses its ability to cushion even normal stresses applied by walking, squatting, and turning. While there are several reasons why your knee becomes damaged or worn, years of normal use are often all that is required to crack and wear away healthy cartilage. This is referred to as osteoarthritis, a condition that accounts for 65% of knee and hip joint replacements. The word arthritis, however, is a general term that encompasses numerous types of bone disease. In fact, there are over 100 types of arthritis. Your doctor assesses the diseased or arthritic condition of your knee by taking x-rays. Here, a normal knee shows spacing between the bones that make up the joint. Comparatively, it's easy to see on this x-ray that there is no joint space and the bones are rubbing together. There are several things you can do before surgery to make your return home easier and safer. Prepare your favorite meals ahead of time and store in small containers. Or stock up on any of the excellent pre-prepared meals found at your grocer. Move frequently used pans, dishes, drinking glasses to a cupboard that keeps you from having to bend or squat and is easy to gain access to. While they may not be considered a problem now, remove loose throw rugs or any other items on the floor that could cause you to slip or trip. If you live in a 2-story house, you'll need to limit climbing stairs. If you normally sleep upstairs, you may want to set up temporary sleeping quarters on the first floor. After knee replacement, you won't be able to drive for a few weeks. Arrange to have a family member or friend who can run errands for you. It's recommended that you have someone stay with you for a few days after your surgery. If this poses a problem, talk to your doctor's office to discuss alternatives such as home health agencies that can send caregivers to your home while you recuperate. All dental work should be completed weeks prior to surgery. Infections in the mouth can enter your bloodstream, endangering or delaying your recovery from knee surgery. A small amount of blood is typically lost during surgery. Many patients choose to donate blood ahead of time for use, if necessary, during the surgery. Blood banks test all blood, even yours, beforehand to ensure its safe use. It is extremely important that you list all medications you are taking or have recently been taking. This includes over-the-counter or non-prescription varieties as well. Your doctor may or may not have special requirements for you to observe. The success of your knee surgery depends on your cooperation and participation. There will be a few responsibilities placed upon you before arriving at the hospital to check in. Everything from what you can or cannot eat to specific hygiene requirements, what to bring, and so on. Again, it is important that you abide by these simple requests to ensure the success of your surgery. If you have questions or concerns, no matter how simple or silly you may think they are, never be afraid or hesitate to ask the medical professionals who are there to help you. With all the equipment, gadgets, and people in masks moving about, things you don't normally see day to day, the operating room can be an intimidating sight. You can be assured, however, the most important thing in that operating room is you. Every piece of equipment, every medical professional, and your doctor are there for your well-being and successful surgery. The implant operation is conducted under general or regional anesthesia and generally takes about 2 hours to complete. Generally, a single incision is used to access your knee joint. While the sequence of events in preparing your knee surfaces for implantation varies from surgeon to surgeon, highly specialized instruments are used to assist your doctor in preparing your bones for an exact fit of the implant. Using your X-ray, your doctor has predetermined what size implants will be used. In most cases, very little bone is required to be removed. The doctor's goal, depending on your anatomy and progression of disease, is just to resurface the bones that comprise the knee joint and thus remove as little bone as possible. Implants are fit to the bone either directly, called a press fit, or with a special bone cement. Oftentimes, screws or other fixation devices may help stabilize your implant for longevity. The decision as to whether a press fit or cemented implant component will be used depends upon many factors. Your doctor has been extensively trained to recognize and consider implant options that will provide you the best results obtainable. After testing the new implant, the surgeon will then close the surgical incision. In many instances, an external drainage device may be used to promote better healing. The surgical wound will be covered in layers of padding and ACE bandages. Your doctor may put a temporary brace-like apparatus on your knee to restrict movement, and you'll be on your way to the recovery room for routine monitoring while you regain alertness from the anesthetic. There may be an overhead frame on your bed with a handle hanging down. This is to aid you in moving around comfortably in bed and sitting up. Your doctor may or may not have your leg placed in a machine that provides continuous passive motion and helps prevent stiffness and promote comfort with your new knee implants. Other things may or may not be used to enhance circulation, promote wound healing, and breathing. It is important that you follow all instructions given by the doctor and your professional medical team to speed your recovery and optimize your results. Shortly after your operation, your doctor will encourage you to use your new joint.
You're afraid of it to begin with because they get you up either the same day or the next day to start walking with a walker, and that sort of scares you. But you can do it. It's amazing.
Almost the following day, they try to get you to take a couple of steps, and then by the second day, I was like going to the door of the room into the hall, and by the end of the week, before I even left the hospital, with the walker, I was going down the entire hall, walking down the entire hall.
I went back to work the second week after I had my surgery, which I told my doctor I was going to take 6 weeks off, and he said, you won't, and I didn't. But I went back to work, and I know that I'm unusual. I'm not saying everybody can do that, but for me, that was just a natural thing to do.
When I first met my PT, physical therapist, and my occupational therapist staff, they sat down and they took the time to explain what the process was. I also realized that it's a team concept. It was a very warm concept, and I could not have done it without their valuable assistance, and they know what they're doing. And they reassured me and my wife, and they worked with us, and always there when you needed it, always answering your questions fully. So I was very comfortable, and I was amazed at the warmth of the staff towards the patient.
Your dedication, compliance, and understanding of your rehabilitation process will help to make the joint replacement a total success. The 6 weeks to 3 months after your surgery are a critical time to take advantage of the benefits of physical therapy. While challenging, the ability to return to walking and exercising is the payoff that makes it all worthwhile.
Rehab is absolutely crucial, to getting back to your normal way of life.
If you have a appendix taken out or something like that, you go in, the doctor does his thing, you go home and you go to bed and rest a few days, and you don't have to do anything. You're kind of just in the passenger side. But with knee replacement, I've learned you have to be active. You can't be a passive patient.
The rehab is gonna hurt. It's you have to punish yourself.
Bicycling, treadmill, working on pulleys, pulling your leg in every different direction to strengthen the muscles in your leg. There's a lot of muscles in your leg, and you have to stretch those and get them back to normal.
The implant needs to be good, the doctor needs to be good, but you have a responsibility to your doctor even to do what you're supposed to do. You can't go home and go to bed and think, well, it'll heal up and it'll be all right. It won't.
If there's no pain, there's no gain. And with every day that I went there, I could do more. And it was less stressful. And I was just like a kid learning how to do mathematics or something. And it became easier every day. And I can remember riding a bicycle for 3 minutes. And I thought, gee, that's great. My last day in therapy, I rode the bicycle for 30 minutes without stopping once. And that's an accomplishment in itself.
As stated early in this program, to further enhance the results of your post-operative physical therapy, rehabilitation should begin prior to surgery. Ask your doctor about a healthy exercise regimen tailored for your lifestyle.
Prior to the surgery, I was becoming an invalid. I had a lot of pain. Pain is gone. I have a lot of mobility now. Who could ask for more?
And sure enough, one day I got up to go do something real quick, and when I got up, I was like halfway where I was going, and I thought, I don't feel my knee at all. It doesn't hurt. It doesn't feel like there's anything in there. It just felt good. It just felt like a leg should feel. And I was just so thrilled at that point that I could feel that way. And I've just been so happy.
Very happy that I had the work done. Very happy.
scale of 1 to 10, my pain was probably a 7 or an 8. And after surgery and rehab, it was down to 0. And everything went smooth and has been going smooth ever since.
It's been a godsend for us because, you know, she doesn't have to worry about talking me in and out of the bed or in and out of the car. Or, it's allowed us to have a lifestyle that's not back to where we were years ago. We're not going out and climbing mountains together, but we can still go for hikes. We're together, and we can do this together. And we plan on doing this for as long as we can. Just gives you an outlook that has quality of life signs all over it. I feel so sorry when I see people my age or even younger that are handicapped, crippled, walking around. I have a lot of friends in my Sunday school class our age, and many of them are literally crippled and need joint replacements. And for whatever reason, fear or just being apprehensive about the results or whatever, they just don't do it. They just continue to suffer and hobble along. And I have empathy for them, but I also encourage them to do something about it.
We thank you for